also you can control. So in this program, we are going to learn first about the yoga therapy. So which condition requires what sort of therapy? Just like as I said, if you have digestive disorder, you cannot treat yourself for headache disorder. You cannot take medicine for headache. You need something very specific which addresses your digestive condition. Similarly, if you're struggling with stress and that stress is the one triggering the acid reflex, most of the time we want to suppress the acid reflex because that's the one troubling. We don't think about stress management. In that regard, the most important part is also to acknowledge the root cause, which is triggering the physical symptoms. Body and mind independently not are the problem. They are the problem, or they have the problems when they're interacting, something which is not natural. Stress is not natural. If it's chronic, natural stress body do manage very often. But if it's chronic, which means it's not going out of your system, then body doesn't know how to manage. In that part, then it becomes unmanageable condition. Then it starts to have a flare up. Now, all the medical condition, there is a classification, if you might have heard me before, on yoga Vashihstha. Now when again, if you want a treatment by yoga therapy, you cannot only refer the medical science, because yoga is not based on medical science. Yoga is based on yoga text. So why and what principles of yoga makes yoga therapy, that's important to know. You will be surprised to know if you're following the yoga therapy principle, it is exactly will align with the medical science. But you cannot treat, anyone cannot treat you or you yourself following the principle of medical science and treating by yoga. So if somebody says, I have back pain, what exercise or what yoga postures do I do? Well, I can't tell you that. And telling you that will be a wrong management, because that is literally with the symptoms you are asking me to telling you a therapy, which is not possible, because according to yoga, there is a classification of conditions, there is management which is prescribed. If you have this, you prescribe this. If you have this, you prescribe that. So now on this, there is no such prescription. We customize, we personalized, and we integrate based on your needs. Your needs will be very different from mine because you are very different from me. Your mind is not same as mine. None of our minds are same as each other. Even our kids are very different. So when we talk about yoga therapy, important to remember 5 koshas. So the therapy go all the 5 koshas, not just annamaya, not just physical exercise. The second rule to remember, it is very personal. So make sure that you use these principles to design your own practice in a way. And not to forget that there is no one rule fits to all. So again, coming back on individualization, we'll see how best we can do. So I'm going to share one screen here, just a diagram, and we'll see to understand how we classify and understand disease and how we do the management. When I'm setting up that, for now, till now, if you have any questions or you want anything to incorporate, please feel free. You won't be coming on the screens. I will be only on the spotlight. So don't worry about coming on recording. Everybody can see the screen? Yeah, okay. So in this screen, as you see, we have mental agitation, which is called Adi, and there is a physical element called Vyadhi. Now, don't worry about all that name to remember, just remembering the mental agitation to the physical. We know this also from mind-body medicine. We also know this from psychosomatic medicine. So medical science exactly define the same. in English, in medical terminology. So there is no difference till here anywhere. So this is mental agitation which starts to come according to yoga. Whenever you have a mental agitation in the mind, which is more than no, more than usual. So again, it stays, it's keep coming back, it's not going away. Then that agitation starts to influence your prana and it makes your nadis unstable. So nadis are in the pranamaya kosha, through which the prana flows. So in the mind, anything disturbs that does influence the flow of prana and that will make nadis unstable. And that doesn't stop here. Then the first response, what we see in the physical level, is through our digestion. So the first thing you will see, you are under digestion, over digestion, or wrong digestion. So digestive disorders are commonly linked with this first sign of having mind agitation coming to the body. Most of the time we ignore this phase because we think, that's all right, we'll take some antacids, we take some lifestyle changes. We don't take care of Adi at this level because physical symptoms is more priority. Now here we classify the diseases into two categories. So one is generated by Adi. So whether your disease was born out of mind, out of the troubles of the mind, whether you were going through anxiety, depression, lifestyle, life changes, grief, bereavement, or marriage, separation, any sorts of life incidents which has affected your mind to be very agitated and struggling. So during that phase, if that's the root cause of your condition, we put it in a category called Adija Vyadhi, which means the disease is born out of the mind. But there is also two kinds. One, if this is the created by mother's mind and passed on into the unborn child, even if she is disturbed, but then she pass on that to the unborn child, we call it Sara, which is congenital diseases. So some of the diseases people are born with, like hole in the heart, like type 1 diabetes. So this is the child, or his mind is not responsible, but he didn't have mind. He was connected with mother's mind. So congenital diseases have a separate category to manage that cannot be managed by any yoga therapy or yoga as what we understand yoga. That has a complete different management if it's a congenital diseases. That is called Sara. Then comes Sara Samanya, which is normal, ordinary. You have problem with your own mind. My personally, if I have difficulty in my mind, struggling with stress, anxiety, any sorts of agitation, and that is affecting my prana and my body, and that became the root cause of my disease, then it's called Samanya, which is ordinary. Most of us fall into this category. However, there is another category which is not born out of mind. So at times, infections, accident, contagious diseases like
Right.
COVID-19 has nothing to do with your mind. It is actually an infection born by the virus, bacteria, or it could be accident, injuries, anything which is non-related to the mind, but it does happen to us. So there, the clinical management is completely different. Now, broadly, if I define all of that in these categories, and I say you cannot have any disease which fall out of this category. All of them are falling into this category. And each one of you can diagnose which category you are falling. I'm not asking medical diagnosis. You all can decide and tell me, or can write
Radio
it in the
Beyond
chat
UK.
box. Sorry. You all can decide and write and tell me which category you think we are falling into. So if I give my example, let's say I fall into Sara, which is, again, if you don't remember Sanskrit name, don't worry, a congenital disease, which is again born out of the mind, but I was unborn. So it's not my mind which created. So that falls into the congenital condition, Sara. So the management is not yoga. Asanas are prohibited because First, it's a heart condition, which is not healthy heart. It cannot have sarvangasana, forward bends, backward bends, all that bendings, because again, this is contradictory. The second is the important part here, the remedy here is called self-realization. Now, what does it mean? It really means that understanding that this limitation which you're born with is not you. You are still beyond. You're still beyond. And once the person realizes that, it starts to manage the mind and body and balance a harmony, and it can manage and stabilize its own condition. We'll talk about more if I find more in the cases if we have, and you would like me to address in more details. But I understand most of us are still in the other category. So I won't take much time on this. But there is another is born out of my own mind. So a couple of years back, I started to develop lupus-like symptoms, fibromyalgia-like symptom. It wasn't a diagnosis as such because the first response was symptoms only. It wasn't set up yet. It wasn't established in the body yet. So when I started to have these symptoms, yes, 2 years back, all the way through the journey, I was going through this chronic condition because I was on the COVID-19, and COVID-19, we all remember our own struggles, but our struggles as a professional was very unique. We were on our toes 24/7, understanding, looking at data, working on communities, or working with the researchers. I think hardly in those 2 years we remember when was the last time and how long could we sleep. All of that, when we had this work positions, work stress, family stress, all together, when this is comorbid, hand in hand, it's not just happen one day. If we want to diagnose these sorts of condition, you also have to consider you had the disease coming in, let's say 5 years back, but you have to consider previous 1 year at least, or not, then at least 2 years, because for 1 year and 1.5 year, body and mind cope very well. They try to manage very well. They give up after that. So if you have symptoms popping up of inflammatory condition, autoimmune disorder, anything into this, you have to consider at least 1 to 2 years behind and see what you were going through. If this is what the reason of the life changes, you had the condition that is ordinary stress-related condition, which we call psychosomatic disorder. It doesn't mean your mind created. It only means that your mind is born out of the stress. Now, again, if we go, for example, people had COVID-19 and then they developed long COVID. It has nothing to do with their mind, or it is a condition, was a post effect of an infection. So here, yoga therapy management is going to be completely different. We cannot treat them with the same asanas. Symptoms are similar. If I say fibromyalgia or chronic fatigue syndrome, let's say CFS, or forget chronic fatigue of any disease. If you have diabetes, you may experience fatigue. If I say fatigue of any clinical condition and fatigue of a COVID patient who has recovered from COVID, but now he has long COVID, symptoms would be very similar. You will be surprised if you do the same yoga for both of them, it will not help post-COVID patient. It will not work on him. He will still struggle with the same symptoms. That shows very effectively that clinical management completely depends on what sort of diagnosis and how we pulling together the management. So the prescription here is a standard prescription in medical science, isn't it? So when you go to the doctor, he knows if you have infection, you start with amoxicillin. It doesn't work, then it goes to another antibiotic. We all know that, right? So in that same way, yoga therapists work. So you come back to him, he says, okay, this is Sara Samanya or it's Anadija Vyadhi. Okay, so I'll start with this management, and if it doesn't work, he will change those combinations accordingly. And if it's you yourself doing it, make sure you do consider these things, because otherwise yoga going to be an extra burden on you. It may create side effects. So if a post-COVID, which is not relating with mind, relating with the viral infection, and then he develops further conditions, then it's not mind, it's not stress. Stress adds on later, but the root cause is not stress. Root cause is infection. You all are be able to follow me?
Yes, sir.
Root cause is what is important. And here, if you tell him, do Surya Namaskar, you'll get energy, do Bhasrika Pranayama, believe me, he will be super exhausted. He will fall into much more deeper fatigue. The reason body is struggling. And on top of it, if you give him the extra burden, the fatigue is going to be much more worse. But similarly, if it's a fatigue related to the stress disorder, yes, this might help because mind is releasing that energy. So the body is feeling relieved. But on this case, mind is not the problem. Body is already overburdened, and you burden more with the 5 rounds of Surya Namaskar. It will be super exhausting. He won't get up for 2 days, and he will never do yoga again because now he's scared what flare ups yoga brings. And that's what the most common mistakes we make into the generalized yoga classes. Okay, so if I cannot stop the recordings in between while we are going here, but I can take question if you want to write it down on the chat box. You can take it from there. So as I see, Samanya. When you define yourself falling into the Samanya category, which means that, the diseases is caused by the mind, agitation. I won't say your mind is a problem. Mind is struggling. So it is passing on that struggle to the prana and prana to body. So in that case, remember, if only you can find that, if when you had the disease diagnosis, during that time you were going through something significant, then yes, it is Samanya. Yes, Sara is only passed on by in the genes or into the placenta. No, genetic doesn't come into this category. The reason behind the genes are not independent. Genes will not express on its own. It always need environment to express. So I carry on the genes of cancer, a heart condition, heart attack, stroke, diabetes, whatnot, if I name it. But none of this will express if I'm managing a healthy lifestyle. So one of those condition or genetic condition is not falling into this category. This category is purely when it's a congenital. You're born with that condition. You're born with that disease. And that only happens with uh, structural demorphin. That only can happen in the womb. So that is not genetic. Sorry, I think everybody is muted, but we still do have bits in here and there. Fibromyalgia and chronic fatigue also can be consequences of infection. Very commonly, chronic fatigue syndrome is the outcome of long infection or long recovery from an infection. Infection might go in 15 days or 20 days, but the symptoms doesn't go. So in that case, yes, that will not be categorized as samanya. That will not be categorized as a mind-related psychosomatic. That's not psychosomatic. According to yoga, we don't see that as a psychosomatic. We see that as anadija vyadhi. And that's where root cause we pick up. And that's where we start to treat. Incidence is usually if you are looking at diseases. And so I would say 2 years is a good time that but it could go many longer. Most of the time, the first symptoms you start to see as a problem starts to happen within 2 years of significant chronic stress. And if that started to happen, that means it's starting to develop a clinical condition. But remember, the clinical condition is one at first. So for example, the very first diagnosis has come of diabetes. But then the stress is still not managed, the lifestyle is still not managed, then you are expected very soon to have another partner joining, which is hypertension, or which could be renal condition, which could be heart condition. So then it's a multi-morbidity. It doesn't stop there, because body and mind constantly failing to manage one in hand, and the burden is still not taken off from the mind. So it will continue to push the prana and anna. And in that case, the body starts to fail, manage many other systems as well. So 15 years ago, if you're talking about, I may also assume at this stage, I only can assume that we are not talking about single condition. We are already talking about multiple condition. Stress always come under Adi. It doesn't come into Sara and Samanya. Sara, Samanya is a classification of physical element. But if we are talking about stress, stress is Adi. Stress is in the mind. It doesn't come to the body in the stress form. When it comes to the body, it takes its form, it changes its form. When it comes to prana, it will start to see digestive disorder. You'll start to see first changes. You're burping too much. You have acid reflux. Sorry. If you had autoimmune disorder, which is born after root cause, again, I will go back into the history. I would like you to remember your own medical history. Go back into the root cause and root cause to see all the way back in the history, whether that's the time you were going through a significant life stress, or you were going through something significant medically, like an infection or injury or recovery, which is again not related with the mind. Mind comes later again, but root cause, what was that? So autoimmune disorders is also both. It is also categorized into psychosomatic elements. We do consider mind plays an important role in management. But again, first management, what do we see the first management? So sorry about the backgrounds, and I don't know who owns background. So caused by mind or body. Okay, so let's take a pause and let's understand what management we are talking. So if we are talking about congenital, we are talking about the management comes from Jnana Yoga. So let me tell you the common prescription and management, which yoga is beneficial for what kind of disease category. So if I talk about a congenital condition which is passed on by mother to child and is born of deformities, deformities of the body or anything in the mind. So in that condition, Jnana Yoga is the key for management. It doesn't need asanas. That is again not at all helpful, and even if you does it, it's not going to be effective. So harmful could be another question, what sort of deformity we are talking. So we're talking about conditions like heart, asanas are prohibited. So here the Jnana Yoga is the prescription. And what sort of Jnana Yoga and how do we implement? That's again, a strict therapist can modify and help that person. Now, when we come to Sara and Samanya, if it's a mind related, so it has come from mind to prana to the body, like all the psychosomatic disorders. The clinical management is a Panchakosha theory. Panchakosha therapy involving where all you have difficulty. So one is mind, one is prana, one is body. But then why mind is getting so agitated? Is that your emotional conflict? Or it's a guilt? Or it's something else triggering your mind constantly? Or it's a trauma? Or it's an abuse? It's a violence? What all mind is getting agitated with? Commonly, this classic symptom is fibromyalgia because of PTSD. Now, PTSD doesn't come, and most of the time, don't diagnose PTSD. We only diagnose because we don't talk about it. We don't talk about our mind. When you go to GP, you talk about your pain. Correct me if I'm wrong. All of us go to our GP and say pain. We don't say our mind. We don't say the life situations we are going through and how much badly we are coping with it because our body is giving up. So we talk about pain. So therefore, the PTSD commonly go undiagnosed, or any sort of anxiety or depression disorder are not diagnosed. So again, that is still there. But why is it there? There is still a root cause of triggering. What is that trigger? If I understand that trigger is coming from emotional conflict, the yoga management will go from Vijnanamay Kosha, but I won't be doing the counseling based on Jnana Yoga. I will be doing counseling on emotional intelligence, how to manage emotions so the emotions stop triggering your mind, and the mind techniques to not control mind, techniques to release mind, relieve mind, technique to help mind to cope with emotional roller coaster, and help with the memory, because memory flares up on surface, mind get agitated, get scared. All of that, the major management of these conditions will be still with emotion, mind, memory, also with your feelings. And so all that management, what techniques we use, depending what is triggering mind to be agitated. Again, asanas is not going to be the first management. When asana is going to be the first management? When there is a significant recovery issues involved. We'll come back on that. Then we'll choose best of the pranayam or the pranic techniques. Never use pranayam because again, pranayam for the expansion of prana, but right now prana is struggling to have its own channel. You cannot expand them. That's for the normal, healthy pranic management. Here, prana is very disturbed. So here, the pranic management, I will give you something after the mind, then I comes to managing prana, because most of the time when I manage and help you manage your mind, emotions, prana is already stabilized. Remaining part, what is unstable, we still do with the pranic management. So which tool and technique to pick, we'll do in the forthcoming week. 1 week, we'll keep it for pranamaya kosha. Then comes to the body. What symptoms in the body? Now, asanas or asana, exercise, or any food, all that comes depending on what symptoms you are affected. So stress is affecting my pain, or stress is affecting my digestion. In these both conditions, whatever symptom in my physical body, that I will pick up the asanas. I will pick up the exercise for you. I will not pick up same exercise for two people who have the stress disorder. It will be a completely different package. It will be a completely different management. Because what is body struggling? When I have stress, I get migraine. I get migraine, I vomit, I can't eat. Complete different management I have to think about, because my body is connected with the whole condition. It is going to affect with this condition very differently. Somebody has stress disorder and that triggers is pain or fibromyalgia. Complete different management on the physical level. So this cannot be the same asanas or same pranayama. Am I clear till here? Is anybody having any difficulty following? Okay, so come back on the Anadija Vyadhi, which is again another big issues for us, which is not actually first root cause is not the mind, but it happened after the infection, accident, injury, and in the post recovery, the symptoms remains. A lot of time in these conditions, we say the clinical management is coming from food aushadhi. Now, you will be so surprised that yoga therapy talks about aushadhi as well. Aushadhi is not in the form of medicine, aushadhi is in the form of food and lifestyle. So, see, yoga therapy is not also independent. It does mention lifestyle medicine as part of it. It also mentions aushadhis as a medicinal plants or medicinal products. What aushadhi will work? So, let's say for fatigue, We are learning right now fibromyalgia from Dr. Nidhi Avasthi. All of you who are part of this Saturday afternoons, she's talking about Aushadhis. She's talking about 3 more management, but one beautiful part I really like that what she has brought is food as medicine. And this is what the yoga therapy also mentioned, that if you have condition like that, the first management is Aushadhi, not yoga, not physical yoga, not asanas, not pranayam, not meditation. The one no, a big no of any of this condition is meditation. Meditation is for the normal, healthy mind. If you have disorders, they ask you to manage disorder first and then go into the normal practices. Asanas is for the normal, healthy body. If you have clinical condition or mind is struggling with Adi, it is pushing prana, it is pushing your body. That means you cannot do any of these normal asanas, pranayam, and meditation. You need modification. You need customized solution to manage first and then. If you have a fracture, can I tell you, go for a walk every day, 15 minutes. Walk is good for everybody. Walk is good for everybody. Yeah, it's a general rule, everybody knows. But if you have a fracture, this advice is not it. This advice is harmful for you because you need rest. You need the bone to heal first. This is the same thing with yoga. If Manome to Praname and Anname is fixing something and trying to get hold of something and control and manage something, you cannot do this normal sets of yoga. You need to fix it first and then you do the normal one. So the clinical management for Anadhija Vyadhi starts from Oshadhi, starts from lifestyle medicine, starts with, then it's add on, do whatever you may require. Okay, any questions here so far, everyone?
So, doctor, so if we are doing all these things, then yoga, meditation, etc., without first addressing the key basic issues, will it be causing more harm to us then?
It may cause harm, but it may not benefit definitely. Depending what sort of, so most of the time, if I say in the community level or with the age-related groups, we are doing gentle yoga. We are not doing anything which could aggravate anything. So you're not going to Bikram yoga or Hatha yoga, which is again more physically aggressive yoga. So hot yoga, hot pot yoga, again, all those extreme, we are not going there anyway. So it will not aggravate so badly because again, it's very gentle. It is not benefiting. Certainly it will not benefit. It's like a benefit. So if you say, generally I feel very stressed, but then suddenly I put a headphone on and I feel so relaxed. So that momentary benefit also you may experience because you're doing something different. But on the body, mind, or any level of therapy, that is not helping. And at times, at the subtle level, it will going to be harmful because you are putting extra burden on it.
Yeah, but then, doctor, diseases like the scleroderma, which is autoimmune, they find no cause for it. So if you don't know what the cause is, how are you supposed to address this?
Okay, so what's the cause of it? Medically, we don't know. Again, please don't categorize or find solution based on the medical understanding. So if I put you here and say, what was the cause? When did the disease start? When did it start? What was happening in your life that time? Were you having any sorts of infection, surgery, post-surgical recovery, or life changes?
Yes, yeah, no, I have got a couple like that in my mind, you say, and one potential could be an infection which was never treated, but that's my theory, you say. because it all started after that. So yeah, it could be either of those, infection or stressful event in the life.
Okay, so we go back a year or 2 years back and tell me
No,
what
no,
was.
no, a long time ago. I'm talking about 2007, 8, when the diagnosis was made. And this is a long time ago. So the events
So
happened around,
2007 was the diagnosis. So
yeah,
let's go more back, 2005.
5,
So
yeah.
whether 2005 or 4, you were going through an infection, or when I say infection, that means infection could be any sort, or surgical, post-surgical infections, which might have subsided by antibiotics or might have been cleared, but then post-infection stayed longer, the symptoms stayed longer, or it was the life-changing situation or stress, which was in 2005.
Yeah,
Four,
right. Yeah,
five.
it could be that, or it could be after that. I was caught in the hurricane, in Mexico, and I did have an infection around my navel, which was never treated because they said, "Oh no, it's nothing. It's just this blah blah blah." So I think it could be that as well. That's my own theory, anyway. Thank you.
So yoga therapy is based on this theory, which we believe has happened to us, which we know happened to us. Again, every doctor works on theory. They don't know practically it's real or not real. So your theory is what I will work on. We all work on. Now, I'll take it from Anadija Vyadhi. Stress might have been added on. Stress is unavoidable part of our life. So when you are going through something significant, I would say, let's say both are involved. So one thing for scleroderma, of course, you need Oshadi, which means something medicinal to manage the symptoms. But also the clinical management, if I have to say from a yoga therapy point of view, it will still go from the Annamaya to Annamaya to all the way to Anandamaya, Panchakosha therapy. And the practices which you pick and choose is very important, that which comes which is in the synchrony of mind, prana, and body. So in this condition, now again, being very realistic, I will also tell you that this can be managed very well. At times, if it's an early diagnosis, we are talking about early diagnosis in last 6 months, this has happened, or last 1 year, this has happened, we have seen reversals. But if we are talking about more than 5 years of these conditions settling in and flaring up or adding on, then it's a difficult of reversal, but we still can manage. Therapy can still manage them in a control. So you can have almost normal life, but anytime you skip, it is there, it can still have flare up. So reversal and management is a too realistic expectation into yoga therapy. So scleroderma, if you are looking back from 2007 of diagnosis, so you are still struggling from Adija, Vyadhi, or Anadija, but again, looking back, it's years of time. So the best management we can plan, and you can control it in a most feasible way.
Thank you.
I would say, depending a question about after how long after surgery you can do yoga, depending what surgery are we talking, which organ, which condition is involved for this surgery. And mostly the post surgical, we say, again, why do you want to do yoga after surgery? What sort of yoga you want to do? So there is a acute post-surgical wards we have done for heart patients. Soon after they come out from surgery, we do some yoga practices for them, making sure they have a swift recovery. My another research project, early 2005, was on the cabbage. So I worked with the cabbage patients who came out of the coronary artery bypass grafting surgery. And soon after they come out from surgical wards, we start the yoga practice, but not physical yoga as we think of, and that does have a significant difference in the post-recovery. So what sort of yoga we are talking about, what sort of surgery we are talking about, that all matters to decide how long. There is no rule of 6 weeks. Never do 6-week rule. for any of these conditions, it's significantly important to understand what condition and what yoga. I will stop the recording here so we can talk more freely and we can answer, or we can decide which management we are going to take. So the homework also I'll talk when I